See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
When you look historically, whenever we've expanded the electorate, we have had better health outcomes. So when women could vote, we saw improvements in maternal child health. When we passed the Voter Rights Act in the 60s, we saw decreases in disparities between African American and white populations.
I got a call from one of the nurses saying our patient broke her water and she really wants to vote. Can you help? I said, I'll figure it out.
As soon as we wanted to talk about voting and health, people went, oh, voting. Maybe that's partisan. We're not supposed to talk about voting. And I'm thinking we cannot, as health professionals, abdicate a whole critical, important aspect of our work.
We know that civic engagement when you're hospitalized really does make you still feel connected to your community. Patients who still feel connected to their community despite not being out in the community heal better.
In the Health and Democracy Index, we look at the ease or difficulty of voting, and we start with how easy is it to register to vote.
I saw a need to enable patients, both in our obstetrical and our postpartum world, and also across the entire hospital, the opportunity to vote in elections when they are unexpectedly hospitalized.
How do we make it clear that promoting and being champions for democracy is actually part of our work as health professionals?
We're providing whole person care. And just because of where you're physically located in a hospital bed should not preclude you from being able to exercise your right to vote should you want to.
It's when you're committed to being sure that the neighbors and everyone is able to vote that your population's health is going to improve.
Welcome to See You Now. I'm Shauna Butler. Voting and health. It's a pairing with a growing body of research and even its very own index, supporting the links between this powerful duo and how they impact and amplify one another and dramatically shape the health of individuals, communities, and democracies. Evidence points to a correlation between civic health, a measure of how involved citizens are in their communities, and engagement in the democratic process and improved health outcomes. This is partially due to the downstream effects of electing representatives who vote for and shape policies addressing our living conditions, such as employment, housing, childcare, education, and environmental quality. And research indicates that voting actually helps us feel better and more connected to our communities. With conversations and debates about democracy, voting, and health policy playing prominently in our headlines, households, and ballot boxes, in this episode, we are taking a closer look at civic health and learning from 3 nurses how increased access to voting improves individual health as well as broad public health measures. We discover how healthcare professionals and systems are making civic participation a national and local health goal. And we explore the creative and innovative approaches that remove barriers to voting and improve the health and well-being of patients, colleagues, communities, and democracy itself.
Hello, I'm Jeanne Ayers, and I am Executive Director of Healthy Democracy, Healthy People, a coalition of 11 national public health organizations dedicated to promoting inclusive representative democracy as a process or a pathway to health. And I'm a public health nurse. I've served as a state health officer in Wisconsin and assistant commissioner in Minnesota. I am 4th generation on a farm in rural Minnesota, 4th generation who grew up there. And my sister and I are the remaining members of that. And one of the things that we discovered that we thought was really important was engaging more people in a deeper understanding of what rural agriculture really is like. People don't have a sense of what a farm is or what the practice of farming is, and or how interconnected it is with everything else in a community. One of the things that was deeply embedded in my experience was that commitment to figuring things out together. We had to come together and be part of an effort to have a rural electrification initiative. When the railroads began to make it difficult for us to make any money on our crops, we came together and built a grain elevator. After the Depression and when we had the erosion of all the soil from our farming practices and the wind and the droughts, we had what's commonly known as a dust bowl. And what happened is the federal government teamed up with the state government, who teamed up with county government to help create solutions. So the federal government provided support, the state planted trees, the county government came together to purchase equipment, and farmers themselves and their families used the equipment and went from farm to farm to farm to plant windrows to stop the blowing. That's just a perfect example of democracy. And I just thought that was normal. That was just how life was. Over the years, I think my experience became that, everybody wasn't having that experience. When I was young, there was a constant conversation going on about world affairs and local affairs. And when people came to get a burning permit, they'd sit down and have a conversation. So there was that public space was happening.
So, Jeanne, that is a very tangible reminder of how we're all interconnected and the power of community. Having grown up on a farm really influenced your practice as a public health nurse.
I went to Marquette University in Milwaukee and was studying nursing, but I was deeply engaged in wanting to have this sort of broader social or community experience or impact. I just thought that was part of being a grown-up, and a nurse. And when I got to public health, my public health rotations, I went, oh, this is it. This is where it comes together. And so I was a rural public health nurse. I worked in migrant health. I went into occupational health and safety. And that was terrific because you learned how to look at systems, a place where people were working, and then what are all the factors and how do you prevent injury in those places. But over the years, I felt like as a field, there's all these things we know intuitively. Like we just know that people need food. We know that stable housing and a good job are connected to health, but we haven't effectively translated them to the political power to pass the policies that make the difference. And so in the early 2000s, I began to bring public health people to my house and ask the question, how do we build the public understanding, the public commitment, and the public will and the political will to pass the policies that we have studied and shown are good? Our theory of change seemed to be study and explain what would be good. That experience convinced me that we were missing something, and that was an analysis of the power necessary to build the public and political will. And I had also grown up in a social justice Catholic tradition. And so I got connected to an organization of faith-based organizing groups. And they would say, well, we're having a meeting next week on housing, but you don't need to come because it's not healthcare. And then I would go and say, no, it is. I spent the first year trying to explain stuff. I would show the connections and I would use the data and I would tell the story. And then I would sit down. And at one point, an organizer said to me, you're going to have to decide, are you an organizer or are you an educator? Because you're putting this brilliant presentation together and then you sat down and you didn't ask anybody to do anything. And you aren't actually asking and showing people the path to creating the change. Mm-hmm. So that was a pivotal moment in understanding that we need to be intentional about building power from wherever we're sitting. And when you look at the pattern of health disparities and health inequities, what you see is a pattern that is rooted in the opportunities for health. Our health is almost completely connected to our living conditions, but our living conditions are almost completely connected to our power to influence them.
One of the things that we want to talk about is the Health and Democracy Index and how it is a community effort and a community commitment.
So the Health and Democracy Index is an analysis looking at the relationship between the ease or difficulty of voting based on the policies that make it easier or more difficult for individuals to vote, and health outcomes that we often use to look at population health. So health outcomes such as infant mortality, premature mortality, self-reported health or mental health. We used 12 of those population level health indicators, and we then analyzed all 50 states and the relationship using what they call the cost of voting index, which says these are the policies that make it easier, and these are the policies that make it harder for people to vote. And it was actually amazing to us, even the clear pattern that we saw between wherever we make it more inclusive, more representative, and easier. When the policies make it easier, we have better health outcomes. So it's not strictly just voter participation. It's the environment that we create for people to be able to participate. It's both of those things together. As soon as we wanted to talk about voting and health, people went, voting, maybe that's partisan. We're not supposed to talk about voting. And people get very risk averse and anxious about it. And I'm thinking we cannot, as health professionals, we cannot abdicate a whole critical, important aspect of our work. And we have to figure out how we work together to raise our voice, to have a chorus that says, no, actually, inclusive governance is critical. And this is why. Let me show you the story. And let me show you the levers that we have within our space that we can use. So in 2020, we brought 11 national public health organizations who have membership, like the American Public Health Association, the Schools of Public Health, the state and local health departments, big cities. And we came together in 2020 because we wanted to be sure that during the COVID pandemic, we were speaking in unison about the importance of voting. And we weren't cautioning people not to vote if they had a risk factor, but we're instead identifying the safe ways that people could vote. So we wanted to be clear, and we came together and initially called ourselves Vote Safe Public Health. It was sort of our on-ramp into this space of promoting civic and voter participation. So when you look historically, whenever we've expanded the electorate, we have had better health outcomes. So when women could vote, we saw improvements in maternal child health. When we passed the Voter Rights Act in the 60s, we saw decreases in disparities between African American and white populations across all sorts of different indicators. We saw decreases in African American infant mortality in the places where they had to have voting laws looked at so that you weren't creating more exclusive laws. Those places had improvements. And we had policies like Medicare and Medicaid got passed during that time. So in the 60s, just the establishment of those programs flowed with the expansion of the electorate. So there's a connection between the policies that are adopted and the representative aspects of our society. And generally, when you look at the countries with the healthier democracies, more inclusive democracies, higher levels of voter participation, you see better health outcomes. We all prosper in those situations. The reason we developed the Health and Democracy Index was that in 2020, we had historical turnout across every demographic, every population voted at a higher level in the middle of a pandemic. And if you remember, we didn't have our vaccines yet. We didn't really have personal protective equipment, but people became aware of the different ways that they could vote. And so we had this historical turnout, and we were tracking it. There were no COVID outbreaks related to the election, which is actually pretty spectacular. And so that was why in 2021, we felt that as public health people and data people, and as a health sector, we needed to step up and tell the bigger story about the value and the importance and the imperative of having a healthy, inclusive democracy, that inclusion and representation actually do translate to better health. So that was when we launched the effort to create the Health and Democracy Index, which came out then in 2021 in August. And another thing that we were trying to do is say, how do we make it clear that promoting and being champions for democracy is actually part of our work as health professionals? So one thing that we did was we teamed up to encourage the Health and Human Services Healthy People 2030 framework. So the Healthy People framework is every 10 years, the federal government and a whole lot of advisors come up with a set of priorities to improve the health of the nation. We collaborated to encourage them to include voting as a health metric. And in July of 2023, they added voting as a core health objective. They've credentialed the research, they see the connection, and they're encouraging us all as healthcare professionals, healthcare systems, and public health systems to be prioritizing strengthening civic and voter participation. And then it's tracked in terms of where we're at and where we need to go to assure the conditions for everyone to be healthy. So that's the thrust of advancing health equity.
You brought up voting and you talked about the story and the levers. So let's start out with the story.
The research does show us that a civically engaged community is a healthier community. And it enjoys greater social cohesion and has more resilience for addressing issues. And we talk about that in terms of civic participation as well as the voting participation. In the Health and Democracy Index, we look at the ease or difficulty of voting, and we start with how easy is it to register to vote? Are people who were incarcerated, are they able to vote? What are the early voting opportunities? All of that gets clustered together into what's called the cost of voting index. Some states are making it easier to vote. For example, Minnesota this year passed a policy that 16 and 17-year-olds can pre-register to vote. And what we know from data about young people's engagement in the voting process is that young people who vote when they're first ready to vote have better mental health, better education, and better economic outcomes. It's a very clear pathway to improving health. And then we know that where there's more responsive government, we can pass the policies that also make a difference. When we remove the barriers and make it a more seamless process, we're communicating that we care and that we have more concern and interest in everyone. And I think you can take that example with people with various disabilities. If a person has a physical disability and can't get into the site, then having the ability to have voting without coming to the site is important. Or when you get there, if a person has difficulty with reading or with language, if there's assistance, we're being inclusive. Those are ways that we communicate inclusivity. When there are visual impairments, that's another impairment that we make efforts to be more inclusive. They talk about the cost of voting. What amount of time do you have to spend to get registered, to take the transportation, to wait in the line? So for the places that have more limited hours and longer lines or less polling location access, those increase the cost of voting for the individual. And I think it's important that as healthcare people and democracy champions, that we raise that. It's not just individual action. It's what we did to create the environment for people to participate. And that has impacts that go even beyond what we've been measuring to date.
So there are a couple things in the index that I wanted you to speak to. You've got this really wonderful headline: voting disparities and health disparities are linked. I mean, you were just talking about some of those, but maybe you want to put it under that headline.
So the very same things that make it hard for people to get to work or have a job are the things that make it difficult to vote. Transportation, lack of childcare, availability of time off work, the hours that polling is available. The awareness and education and encouragement to even register. One of the main reasons people don't vote is that they say they weren't registered. They were afraid to register. They didn't know how to register. Nobody asked them. So one of the connections with health disparities is housing instability. People who've had to move, young people, college students, new professionals, and people with unstable housing situations move more frequently, and they aren't homeowners often. And so they are not getting all the same attention, and that's the same set of people who often experience other kinds of health disparities or barriers to food access, to safe housing, and those things carry through on our health outcomes.
The index itself is super, super interactive. There's this area that says select a public health metric to see how it correlates to voting access across states. And so you can select on metrics that include poor mental health days, adults receiving disability benefits, premature mortality, community and family safety. So how do you use this index to share that connection between increased ease of access to voting and improved health?
So we wanted to use indicators of population health outcomes. The way groups can use that is the ones that are most relevant for them. We've been working on improving maternal mortality and infant mortality, and see, here's data that shows that this is related. Or if you're looking at the healthcare access, so if you're a health professional in a state that's considering making it easier or harder to register to vote, you can bring your voice to that and say, look, here's the data, and you can show up as a health leader in that space. We had a set of people in both Minnesota and Michigan who took this data and testified in their legislatures when they were considering adding automatic voter registration to Medicaid, or offering pre-registration to 16 and 17-year-olds, increasing access for polling locations for colleges, and reinstitution of rights for people who were previously incarcerated. So health professionals were able to join community advocates and voting rights advocates and be a part of something bigger, that intersection of building their collective influence to get these things passed. A very powerful policy is adding automatic voter registration to Medicaid. There is a law on the books called Motor Voter, which when you get your driver's license, you're supposed to be offered the chance for voting registration. But who has cars and gets driver's license are different than who may be eligible for Medicaid services. And Shauna, the places where they've piloted and tested secure and automatic voter registration with Medicaid, the disparities in who does and doesn't vote disappear.
The other one that I wanted to have you speak to is this wonderful initiative about Thrive through Civic Health. We Will Vote, and it's very focused on health systems and their employees. We have heard many data points about the mental health and well-being of our healthcare workforce. Health system executives are searching for and working on how do we improve the health and well-being of our healthcare workforce. I'm not sure that they've translated and said, wow, helping our workforce in being able to register and vote, this is a really powerful way to improve the health and well-being of our workforce.
Shauna, there's a lot of aspects to this, but one of the things I want to start out with is that the health sector itself is huge. It's like 22 million people are in the health sector, and I think that's a underestimate because it probably doesn't include all of us who aren't working in healthcare buildings and some of us in food safety or other areas of public health. So 22 million, that's 14% of the US workforce. And I'm going to throw a little bit of statistics here. In 2020, we had this historic turnout. And even though we had a historic turnout across all the various demographics in the country, more than a third of the population didn't register and vote, of eligible people didn't vote. In 2022, only 46% of eligible voters voted. And that's not a healthy democracy when you don't have a higher level. So that's kind of disturbing. And then we found out that the health professionals themselves, licensed healthcare professionals, are somewhere between 12 and 23% less likely to vote than the general public. Even nurses are somewhere between 7 and 13% less likely to vote than the general population.
Got any insights as to why healthcare professionals are voting at rates below the general population?
Some of my thoughts, not research, are that we're really tapped out. We believe we're doing everything we can. We're working. Our people that come to us have all these other problems. Everything feels sort of overwhelming. I think it ties into this burnout. Like if you think you have no power over anything and you're just do some more. I think there's an aspect to that. And one of the things about voting and why we're doing the Thrive Through Civic Health We Will Vote initiative is to say that if 8 to 11 million of us are not voting, well, look at what would happen if we added our voices. In faith-based organizing, what you find is that people who may be overwhelmed and depressed actually become healthier and have better well-being when they are civically engaged. We talk about having agency, believing you can make an impact in your world and your life. I mean, my experience is that people working in healthcare, especially in the last decade even, or 5 years, don't feel like they have much of a sense of agency, that they have any influence in either their institutions or their field or the community at large, and certainly not to help address all the needs that they are confronted by from their patients. And so the idea that we have not actually ever organized as a collective, I find both amazing and hopeful. Like, let's organize ourselves as a collective. So we launched in 2024 this effort, Thrive Through Civic Health, We Will Vote. But we basically are it's just simple. It's like, let's just all say, if we're in an institution, that our institution is going to say that we're going to encourage our employees or our members to vote. We're going to make sure they know the dates that they have to do things. We're going to get some information. And we invited organizations. We had a launch event in February of 2024 that the National Academy of Science, Engineering, and Medicine hosted. And we, along with Vote ER and the Civic Health Alliance, launched this national initiative. And right now we're about 63 partners representing 99,000 plus people have joined this effort. Ideally, over time, they would not just be encouraging their employees and members, but they'd be using their public roles to encourage the people that they serve and the community at large. But this was just an easy on-ramp. Like, how do you start? Where do we start? Let's just do this thing. And what if those 22 million people actually showed up saying inclusive representative democracy is important? We're going to be for democracy. We're going to be sure that we're working to encourage civic participation in the decision-making spaces. And I don't mean like just federal elections. I mean, this goes all the way to the school board, to the county boards, the city councils, the park board. All of those roles end up having an influence on the conditions that people live in. And so I'm pretty excited realizing that encouraging healthy representative democracy as part of our work is a breakthrough for many organizations.
And the thing that you lead with is the top recommendation is restore civic participation to our national health goals. What does it mean to restore civic participation to our local health goals?
Oh, I love that question. So when you're creating system change, you do have to pay attention to every level. You might only have influence in one space, but you think about the space above and the space below and how can you influence these. And so one of the reasons that we, as a national coalition, asked the Healthy People 2030 team to add civic participation and voter participation back into the goals was because that helps set the stage. It helps us be able to point to that when we're at another level. So I was the state health officer in Wisconsin, and before that I spent almost 8 years as the assistant commissioner of health in Minnesota. And in those roles, one of the things that every state health department does is it sets state health goals. And it looks at all of its research and its data, and it convenes teams of people and groups and organizations, including healthcare delivery systems, to say, what should we be focused on for the next 10 years? Or actually, with the state health plans, it's usually 5 years. And then you say, these are some of the actions that we're going to do collectively, or we're going to prioritize. And so what you measure matters, because that's what helps pull and direct the action. Historically, many of our health assessments have measured disease, and it has less often focused on the conditions that create health. So in our role in Minnesota, one of the first things we did back in 2012 when I first got there was our health assessment, we began to say, who's graduating from high school? Who owns their own home? What are those broader conditions? And adding the who's voting becomes another one of those conditions. And Minnesota just added into their current health assessment voting as one of those conditions that they're tracking. That's like the state leadership. The next level becomes the counties and the cities, and they all do these health plans. They prioritize what they're going to do. And as everybody looks over their shoulder, the state looks at the feds and the counties and cities look at the states, and you're trying to create a collective energy in a certain direction. I was having a conversation with a nonprofit health insurer who was very engaged in encouraging their employees to vote, but they said, we aren't sure we can talk about this publicly as a public call to action. And I said, wait a minute, now you can, because Healthy People 2030 and the state have both named this as a health action. And so then community health clinics and federally qualified health clinics and community health workers and others are finding that when their organizations then are on board, they can enter a conversation with a patient, not just their colleagues and their families, which we want everybody to do, but also with the patients and the public that they serve. And so then you have the backing, and you're part of a collective action where you can make sure that there's a voting QR code on how to register posted in your clinic. One of my colleagues has for years said that when, as a pediatrician, he used to ask parents, are you registered to vote? That was 30 years ago. And now we actually have groups like VoteER who are helping equip the providers to ask those questions in a clinical setting. So when you think about how to change practice and how to change a system, you think, what are the levers at this level? What are the levers at that level? How can you align them? And how, if you use those three practices of changing the narrative, expanding the understanding, the resources and the policies, you can change stuff. So that's what's exciting.
One of the things that you said in another conversation that really struck me is you said that people think about voting as an individual thing, but it's actually a community commitment. It's the community commitment to inclusive voting that really improves health.
I think we have a lot of evidence to show that health isn't just an individual experience. Our health comes from our community experience, from the conditions that we are living in, from the families that we are in. It's all part of a system. And one of the challenges in our nation, actually, is that we have really amplified the individual aspect of almost everything. True. I mean, yes, we should be exercising and eating well and, doing these things, but it is only a part of the picture. And so as a public health person, we have been saying for a long time, the broader conditions matter, but we haven't translated it into the democracy space. So in democracy, we still act like voting, whether or not you did or if you do, and it's all individual. And we know it's a private act and we want it to be a private act. But the fact is that whether or not your state makes it easy or hard for you to vote is going to impact the health of your whole community. It isn't like you voting alone is going to improve the health of the community. It's when you're committed to being sure that the neighbors and everyone is able to vote that your population's health is going to improve. I don't think 46% turnout leads to a stable democracy. We should be all committed to being sure that we have full participation. And that does create a stability factor both for our own nation and for the international community as well.
Jeanne Ayers is the Executive Director of Healthy Democracy, Healthy People, a coalition of 11 national public health organizations dedicated to promoting an inclusive, representative democracy as a process and pathway to better health. The data is clear. Where there is more voting access, we have better health outcomes. And as Jeanne explained, there are many barriers to voting, and removing barriers to voting and registering to vote is a key component to those better health outcomes. Illness, injury, and hospitalization are unique barriers to voting, and an insight and experience that inspired 2 nurses in New York City to figure out a way to help unexpectedly hospitalized patients to cast their ballot from their hospital bed.
I'm Erin Ainslie Smith. I am a registered nurse at Lenox Hill Hospital in New York City. I am a postpartum nurse by training and have moved into a patient education sphere. And in 2016, I saw a need to enable patients both in our obstetrical and our postpartum world and also across the entire hospital the opportunity to vote in elections when they are unexpectedly hospitalized. So in 2018, my friend and colleague Lisa Schavrien and I launched the Vote North initiative to enable patients to be able to vote from their bedside the days leading up to and around the election.
I'm Lisa Schavrien. I'm the nurse navigator and OBGYN at Lenox Hill Hospital. I've been at Lenox Hill for over 20 years as a labor and delivery nurse, as part of our leadership team, assistant nurse manager. I help to personalize patient care and experience and anticipate needs of our expectant families.
The community, the Upper East Side community, thinks of Lenox Hill as their community hospital. So it has that feel, but what I think is really great about Lenox Hill is that we are not only providing medical care, but we look at the whole patient.
And we also know that patients who still feel connected to their community despite not being out in the community heal better.
So to us, offering the opportunity to participate in Vote North and to have your vote heard is just part of the healing that we're trying to provide at Lenox Hill.
The two of you have created this national awareness and this movement recognizing that when people are hospitalized during an election cycle, if you're sick or you're in the middle of active labor or you're getting ready to go to surgery or any number of circumstances, your ability to go cast your ballot gets interrupted. What's the story behind awareness that this was a problem, that people were not going to be able to vote?
So in 2016, in the middle of the night, around 3 a.m, which would have been on like a Tuesday morning, I got a call from one of the nurses saying our patient broke her water at like 36 plus weeks, which is a month early, and said, well, what am I going to do? I have to vote today. Can you help? So I said, I'll figure it out. I had no idea how difficult this process would be. And I called the Board of Elections, who basically said, well, that's really nice of you, but she can't vote because she didn't get her absentee ballot by yesterday at 5. I'm like, well, that's the wrong answer, because yesterday at 5 p.m. she had planned on going to the polling site in the morning. But then at 3 a.m. she broke her water. And it was important enough for this person who was excited about having her first baby and vote that day. Clearly that was something that was of importance to her, or she would have been focused on only having her baby and not what was going on at the polls. We left it with, well, I don't know what to tell you. If you get a court order, you can get her a ballot. So, of course, I met with the judge, got a court order, and brought her ballots. They voted. Okay. And that's how it all started.
I mean, it's so funny listening to Lisa tell this story, because that was in 2016. And even just listening to her be like, you should be able to be excited about having your first baby and voting, like, still it gives me chills that you shouldn't have to choose. They are both things that we should be able to be excited about in our lives. And so I was doing my clinical rotation through labor and delivery at that time. And I was thinking like, well, these other patients are in labor, so how are they voting today? Because in 2016, New York did not have no excuse voting. So the only way you could get an absentee ballot in New York was if you had a medical reason, but you had to have had it prior to the day of the election. And you had up until the day before to go in person to get that absentee ballot, but to have it mailed to you, it had to have been 2 weeks before. So we didn't have that option, whereas other states, you can just apply for an absentee ballot because you're in late pregnancy. So there's always the chance you're going to deliver, or you may have a surgery, or you're having to go visit your daughter who's having a baby, right? Whatever the reason is, you used to have to have an excuse in New York. So we had all these patients who were unable to vote. There was no early voting in New York in 2016 either. So the options were really limited for emergencies and last minute life in general. And so I then vowed that by 2020, we would have everyone in the hospital having the option. By the way, I didn't have a job at Lenox Hill at that point, but I was hoping to. That by 2020, I would A, have a job, and B, that we would have the option for every patient to vote if they wanted to.
So Erin came to me and said, you did it for that one person. We have a hospital full of patients that weren't planning to be here likely on Tuesday. Shouldn't we offer it to them?
And here we are 6 election seasons later that we've been running this and loving every moment of it.
So when you say running this, what is this?
So we named this Vote North. Northwell, we're always thinking upstream at Northwell. So we wanted to think for the future. So Vote North was born. And for the 2018 midterm election, Lisa and I went around our entire hospital.
37 weeks pregnant.
I was 37 weeks pregnant. And my husband had to say, should you apply for an absentee ballot, Erin? Because you have a medical reason to. As the person running the program, didn't even occur to me that I might deliver early. So we went bed to bed asking patients, are you registered to vote? Have you voted absentee previously? Would you like to participate? Participate meaning we will get you an application for an absentee ballot. You will complete the application. We will take your application to your county board of election, where we will get your ballot, your personal ballot. We will bring it back to your hospital bed. You will complete your ballot, and we will then return it to your county for you. And we had 26 people who participated in the midterm for 2018. We had this woman, Margaret, who Lisa can tell you about. And if we had never had another patient after Margaret, it would have been worth it.
It was funny. So Erin and I said, okay, well, it's going to go one of two ways. We're going to walk into a room and a patient's going to say, I mean, listen, that's really nice of you to offer and all, but like, I just had my hip replaced. I mean, no thanks. I got to deal with trying to walk. Or they're going to say, okay, stay tuned. We didn't know. We start rounding the Sunday before the Tuesday election, because on Sunday, we should know that patients will or will not still be there on Tuesday, likely. So I walked in to Margaret's room. Her family was there. They had all come after church. It was Sunday. And I said, hello, my name's Lisa Schavrien, and I work in obstetrics, and we have an initiative that we're helping hospitalized patients to vote. And the room erupts in like, hallelujah, thank God that you're here. And she looked at me and she said, I told them that they can't cut into my head on Tuesday until I voted. She had a brain tumor. She was having brain surgery, literally. No joke. This is what she said. And it was like, if we did one ballot ever, that was 100% worth it.
Also, there was a couple, the husband had a stroke and started to fall, and his wife went to catch him and she fell. And so they were both in the hospital on different units. So neither could help the other one vote. And so here we come along to help each of them vote.
Lisa, you mentioned that you're going into the hospital rooms, talking with people, and you're offering them, would you like to vote? You know, people might think it's not really part of clinical practice. How is it that providing the mechanism for people to vote as integral, a really essential part of the care that we provide?
As nurses, we look at the patient in their entirety. For people who are cognitively aware of their surroundings and yet are still unable to get to a physical site, if it's important for them, they should be empowered to cast their vote if they choose.
As Lisa said, we're providing whole person care. And just because of where you're physically located in a hospital bed should not preclude you from being able to exercise your right to vote should you want to. If you have someone sick or well, whatever your reason for being in the hospital is, your support team, your partner, your parent, they don't want to leave your bedside, even if they could, to go and do this. So it then doesn't happen, because if my choice is leaving my family member to go to the Board of Elections, give the application, collect the ballot, go back to the hospital, have the person fill out the ballot, and then go back to the county to return the ballot, that could be a lot of time. So to ask someone to step away from their family member's hospital bed, it seems unreasonable. So we are here to fill in that gap. And our program is not at all partisan. If you want to vote, we are offering you an opportunity to. If you choose not to vote, that is fine. But we see it as just an option that we are offering in the hospital, not a requirement by anyone by any means.
How many people does this impact, from the standpoint of they're at risk of not being able to cast their ballot because of an unforeseen medical visit or medical condition?
In 2019, there were approximately 600,000 people hospitalized daily across the entire country. About 6,000 of those are in New York State, and there's around 6,100 hospitals in the country. And again, every state has different rules about voting, so not all of those people are prohibited from voting. But there is the potential that they could all be, depending on their circumstances. If you were on vacation, which we've seen, and you were from Seattle and you slipped and fell and you're in the hospital in New York, we can't help you. So there's still going to be cases that we can't help with. But since 2018, we've helped approximately 500 people to vote.
So the Vote North program, it's pretty expansive from what I've read. So what is the Vote North program and who's involved with it?
So Lisa and I started Vote North, a program for patients who are unexpectedly hospitalized to be given the opportunity to vote on an election day. Northwell then took that Vote North concept and grew it to children writing poems, grew it to voter registration drives, grew it to debate watch parties. They took our little program, and then people within the organization who had their own brilliant ideas said, let's add this into it, so that it became this comprehensive platform that started with a patient voting initiative and grew to this beautiful thing.
In 2020, we opened up our program that we have started with patients to staff, because we have staff that are working around the clock through a pandemic, right? They're equally entitled to cast their vote too, knowing that they can't necessarily step out of the ICU for a moment.
So we Northwell said, this is important to make sure that our staff has the ability to vote with ease, just like we want our patients to, so that they can provide this amazing care to the patients that we see. So we now are having tabling events for staff for voter registration, where people are set up at a table and they have some electronic device that allows for you to go on to the New York State or whatever state you live in registry and confirm if you are registered to vote. If you are not registered to vote, you can, in that moment, online register yourself, or we have paper copies because some counties require you send it in by mail. We have the registration dates of when you have to be registered by in order to vote in an upcoming election. And so it makes the process of registering so much easier. And a lot of people we have found think they're registered and they're not. So it's a really good check that everyone should be doing in election season to just verify your registration status, to confirm you're registered and you're registered where you think you're registered. Because we've had patients who have told us, my address is in Brooklyn. We go to Brooklyn and they say they're not registered here, they're registered in Queens.
We know that civic engagement when you're hospitalized really does make you still feel connected to your community. And we know that empowering patients to still feel like they can have their voice heard should they choose to at a time where they kind of feel stripped a little bit of their empowerment due to the fact that they're hospitalized.
We see this as not related to your diagnosis or your sickness, but it's just you are physically in a place that you don't have the opportunity to vote in elections otherwise because of the systems that we currently in this country have in place. And so to sit there and not be able to participate and not feel like you, in history, that you played a part in that, I think if it's important to you, it's not only helpful to your healing, but I think it can be detrimental to not be able to have that say. We are open to helping any hospital, any organization who would like to offer this. We are happy to help with that. We do have a patient voting at northwell.edu email address.
We've always said, if any hospital anywhere would like to start a program, we will help to facilitate getting it done.
Nurses Lisa Schavrien and Erin Ainslie Smith launched Vote North, a Northwell Health initiative enabling patients to cast their ballot from their hospital bed in the days leading up to and around elections, a program that continues to evolve and expand and is part of the national nonpartisan organization Patient Voting, whose mission aims to increase voter turnout among registered voters across the nation who are unexpectedly hospitalized in the days and weeks prior to elections. Jeanne Ayers is a public health nurse, the executive director of Healthy Democracy, Healthy People, and a champion of the Health and Democracy Index that uses public health metrics to analyze the link between public health and civic participation. And it begins by looking at the ease or difficulty of access to voting. We've always known that voting is a foundation of democracy, and increasingly, we're understanding voting as a foundation to health, as an important opportunity for people to contribute to and feel connected to their communities, their professions, and their own personal health and well-being, part of the social fabric that is we the people. As election season heats up, now is a great time to sharpen your civic health practice. Be part of removing barriers to voting. Make sure you're registered to vote and encourage voting amongst your family, friends, neighbors, patients, and colleagues. As Jeanne Ayers highlights, when we remove the barriers to voting, make it an easier and a more seamless process. We're communicating that we care and that we have a concern and interest in everyone. And that's what health and care is all about. For See You Now, I'm Shauna Butler. Thanks for listening and for voting.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.